Well, I like learning things new. I like being part of a team, and I like knowing that I'm helping making a difference to people's lives in a way.
What I really want from this group today is for everyone to feel like they can be a part of the group and talk and have a voice.
Decode is about people with learning disabilities and multiple long-term conditions. 2/3 of them with this population experience 2 or more multiple long-term conditions. And it's really difficult to diagnose in time. There's often delay and misdiagnosis. And the issue is that because of that, they often die much younger than general population. So that's the issue we want to address in Decode.
PPIE is patients and public involvement and engagement. And PPIE is that community of people with learning disability and carers for our research being part of our group to shape up the research. Patients and public involvement is crucial.
Until recently, research was so separated from the groups that it was for, it remained on dusty shelves and the outcomes were hardly kind of impacted in the wider communities that they were meant to be serving.
Ethical research is always the way forward. That's how we find things out. And if you've been asked to join the research, it's because you've got something to give.
And I thought, yes, I'd love to join. And I come to every meeting.
There are lots of ways that we try to make the groups accessible. So we book taxis for people, we book accessible venues, we check people's dietary requirements. We try to make all the information really accessible and easy to understand by using easy read language with pictures. And we have a speech and language therapist and a learning disability nurse who attends all the groups to support people either one-to-one or in a small group and really break down the information for people.
We talk about it, whether that's easy to understand or is that a bit too much. And then we find a solution, what would make it actually better.
Use also good and bad. This has been very different because the PPI members are like my very needed critical friends. So they tell us what is working, they have told us what is working and what is not working. And for me, that is really helpful.
I've probably seen more like the barrier.
It's really important for people's voices to be heard and for people to be listened to. The project is about and for people with learning disabilities. Listening to what people are saying and then being able to take that and feed it back to the research team.
We have a huge data set from England and Wales, and we are using state-of-the-art AI methodology to unpack the pattern from this data set.
There's a lot of insights, a lot of things that the AI models reveal. We want to be able to have the data which is as accurate as we can get and use it to make predictions, use it to create an analysis. It's easy to just see this as numbers and say, okay, yes, the AI model takes this and this is the output. So this is what you get and this is what you don't get. The idea is we just want to give the patient and their care providers also some power, some influence to be able to know potential risks for the patients they're caring for, and also that would give insights on how to manage symptoms.
We want to develop not just new knowledge, but also actionable insight from this new knowledge, which means that we want to think about how to reimagine the way these cares are provided, how we can support professionals, also carers, to come up with better health actions, how we can support policymakers to develop new commissioning strategy and then also new joined up pathway from this new knowledge.
So in a nutshell, we're taking really complex numerical data, we're turning it into stories and we're communicating that to people with learning disabilities to help them to understand their health better.
My son's now 24 and I've been a parent carer since, well, the day he was born. So it's just good for somebody to actually acknowledge that we have some areas of expertise and opinions that could make a difference to the lives of other people.
What are your favourite things about being in the PPI group?
I actually like the other people, and I think that's got to be a real basis for it.
My favourite things would be getting a chance to help people learn what the research is about. Also good for myself, it will help build my confidence up.
Being in PPI group, I've learned that everyone is important and the research is very important and that will help in future. So it's really, really good to be part of the research group.
Basically, don't worry about coming to Decode because you have nice people like Sarah, Amy there, who will make you feel welcome.
To see this research, which has been so carefully planned and is so about all the participants, has been an absolute joy. It really has.
You gotta get up to get down, kid. Hey, you gotta get down.